Hi, I'm Erica Smith, Surgical Solutions Manager at Henry Schein Medical, and I'm here with Barbara Smith from Coastal Virginia Surgery Center, and I'm here to interview about her experience in ASCs and any opinions that she has about the ASC field. Barbara, thank you for joining me today.
Happy to be here.
As healthcare professionals, why is it important to stay informed about ASCs and their role in the healthcare system?
Well, right now in our industry, it's a very exciting time. Because of microsurgery and anesthesia, we're now able to do cases we never dreamed of doing just a few years ago. We're able to do spines, total joints, etc. We need to stay on top of it so we know what's available and what we can do.
Right. It's crazy to think that total joints can be done in an outpatient setting now.
Yes.
And, you know, I just see many, many more procedures heading this way.
And actually, it's been predicted that by the year 2030, about 80% of procedures will be done in ambulatory surgery centers.
Wow.
You'll only go to the hospital if you have to stay overnight because of comorbidities or something about the surgery that needs longer care.
Wow, that's crazy. So ASC is where to be.
Yes, ASC is where to be.
We need to make that a slogan, guys. In your experience, what are the main advantages of working in an ASC?
I think one of the things that is really significant is when a patient returns their questionnaire and says that they feel like they had individual treatment. It's such a plus for our staff to see, especially after a busy day, that the patient felt like they were the only ones there.
Right. I've had surgery in outpatient in ASC facilities, and you're right, it does make a difference. Instead of just being another case, you know, they really care.
Yes.
So what advice would you give to fellow healthcare professionals who are considering a career transition to an ASC, and what typically surprises professionals new to the ASC setting?
Well, you have to be prepared to answer a myriad of situations that come your way every day. And if you don't know the answer, know where to find the answer. I think the thing that surprises people is they have the impression that it's a 40-hour-a-week job, and it's not. And it also offers a lot of challenges. So if you're up for challenges, then the ASC is the place for you.
What are some innovative practices or technologies that ASCs are embracing to enhance patient care and operational efficiency?
Technology has given us the ability to make very small invasive incisions, plus anesthesia has become so much better. The side effects are minimal, and we can get a patient under long enough for their surgery, but once they're in PACU, we discharge patients within an hour or 2 hours after surgery.
Wow, that's really fast. And
yes,
with technologies, you know, really growing, we talk about like AI, and some people get scared of the AI type of technology.
Yes.
However, I do think in an ASC setting, AI can even help us improve more procedures and practices, to your point, to get them in and out quicker.
We're interested to see where it fits in with us.
Right.
We'll just see what develops in the coming years. It's going to take a few years to trickle down to us.
Yeah. So how does working in an ASC foster a patient-centered approach to healthcare delivery?
I think in an ASC, we're able to give really individual care. The patient leaves here feeling very comfortable that if they had pain, it was relieved. If they had concerns, it was answered. And there isn't any better PR than them telling their family and friends, I had a great experience.
Yeah, no, you're right. That's the best publicity that you can have.
Yes.
So that's awesome. So how can healthcare professionals within the same specialty or subspecialty collaborate and support each other in an ASC environment?
Well, we have, in the United States, very strong ASC state associations. If we have a problem, we reach out to the other state members as administrators and say, have you had this problem? What were your solutions? And so we have a strong network, so we're not solving the same problems on our own. Mm-hmm. We also, in some states, are fortunate enough to have the same sort of collaborative environment for our clinical staff, because mm-hmm. we're talking about administrative staff, but the clinical staff also have issues that is helpful that they can talk to their peers and say, what did you do in a case like this?
How can healthcare professionals get involved in promoting the growth and success of ASCs in their communities or regions?
In the community, people, even now, don't really understand the strength of an ambulatory surgery center. It was actually started in the format we know today in 1970. Mm-hmm. So you would think by now everybody would know about ASCs, but they don't. The things I've done is start seminars that our doctors provide in our ASC setting on subjects that the community are interested in, and are able to ask the doctor questions about maybe what is a knee replacement, what is a hip replacement, where if they went to the office they'd have a short amount of time. Another way is we go ahead and reach out to charities in our community,
that's awesome.
Especially at Christmas time. Mm-hmm. We randomly select the charities, and we always change them from year to year.
Oh, that's awesome.
But we support them with whatever they need at that time. And after a few years, they get very accustomed knowing that we are there. In this particular community, our doctors have formed a not-for-profit called Embrace. Mm-hmm. And we collect wheelchairs, canes, and donate them to specialists that need that type of thing in certain areas here in the communities.
So if people wanted to learn more about Embrace, can they go to your website to learn more?
There is a website,
okay.
Or they can call here,
okay.
and we'll put them in touch with Shannon, who runs it.
Okay.
Yes.
Awesome, awesome. So to switch gears here, what are some misconceptions about ASCs?
People may not feel or believe that we can deliver the kind of care you get at a hospital. The fact of the matter is that if you see a doctor to have a knee replaced in the hospital, it has a certain cost. The same doctor here, it is a lower cost. We're able to charge less, so your copay is less.
Right.
People don't realize that. Another important factor is that within the ASC industry, our infection rate across the board is about 0.4%. In a hospital across the board nationally, it's 13%.
Wow, that's big.
Yes. Our particular percent is 0. We have never had a patient who has reported infection in all the years we've been open.
Wow, good for you.
That's
amazing.
We're really
awesome.
Proud of that.
Yeah, you should be.
Yes.
That's awesome.
It is.
So how can the industry, such as companies like Henry Schein, continue to support ASCs? And could you provide any anecdotes about the most fun, engaging, educational, or enlightening experience your rep helped foster or uncover for you?
When I arrived, I came when it was a cement floor and girders. And I had 4 months to get everything you see from the walls to the middle of every room. I had to choose what vendor I was working with, and I chose David Horowitz with Henry Schein. Everything you've seen here today has been purchased through Henry Schein.
Wow.
About January 28th of 2020, we had gotten as much on paper as we could, and David said to me, "Are you ready to sign off on this?" It was about $890,000. And I said, "I think I better just start putting the orders in." As we know, a month later, everything shut down.
Yeah.
But Coastal Virginia orders were in due to David, and we were able to get our monitors, our anesthesia machines. Everything you saw today came in slowly, but surely due to David. I was so appreciative of the support that Henry Schein showed us at that time. It was Mike and all the way up the ladder, and they made us whole.
Wow. Wow. Well, we are honored that you have chosen to build this entire facility. We are so honored that you choose us as your distributor, and hopefully we can continue to support you and everything and keep you guys growing. Yes. So what do you rely on most from Henry Schein?
Now that we're settled in, you are our major vendor for our supplies, our medical supplies and drugs.
And we'll still be
Yes.
your primary vendor for everything.
Yes.
You just let us know.
Yes.
We'll bring it to you. And what is the biggest value Henry Schein has provided you?
As we grow and expand, there are all sorts of opportunities that you have within your umbrella. The ability for us to use you for getting staffing, also for reprocessing, things like that.
Great. And last question here.
Yes.
What makes your facility special? And could you explain your Black Diamond system?
I think what makes us special is that this was built on leading edge. We didn't really realize when we started that one of the national healthcare organizations called Becker would be picking up on what we do. And so far we've been written up by Becker's 5 different times.
That's amazing.
We've done one only. Dr. Schneider did an arthroplasty replacement with eye total. It was first done here in the United States. And of course, Dr. Carlson was one of the first to do 3-level lumbar fusion in the United States.
Wow.
All of these things have made us feel that we're able to provide our doctors with the ability to move with the times. And we're also very proud of that. We have something called the Black Diamond system, and that is our ability to live feed nationally and internationally any procedures that are done by our doctors. Wow. So they're asking, if you're doing it in an ambulatory surgery center, can we see how you do it without flying in? And so that's what the Black Diamond system will be used for.
Wow, that's amazing.
It is.
That's amazing. And you guys have so much to be proud of. I mean, I was taken aback just when I first walked into the facility, seeing how you guys do things in the OR and sterile processing and just hearing what you guys have done for your community and more. It's just amazing. It truly is amazing. And again, we're so appreciative that you've chosen Henry Schein to be there with you and to support you, and we'll continue to be there with you and support you through whatever your need is.
Thank you.
So thank you so much
You're
for
welcome.
joining me today. I know we took time out of your busy schedule, so we greatly appreciate it. And thank you guys for listening in on our interview. Again, my name is Erica Smith with Henry Schein Medical. We'll see you next time.